Speaker, the PC caucus has consistently raised examples in this legislature of how the Liberal government's rationing of healthcare dollars is negatively affecting patients. The Auditor General's report yesterday confirmed that wait times for surgeries have increased and the health of those waiting for life-saving treatment has been jeopardized. Due to chronic underfunding, elective and emergency surgeries must compete for OR time. 25% of patients with critical or life-threatening conditions must wait double the expected time for surgery. Only 33% of neurosurgeries were completed within the ministry's target time. Mr. Speaker, will the minister admit his government's policies are failing Ontarians and explain to them why they should trust this government's plan?
Thank you. Minister of Health, long-term care.
Well, thank you, Mr. Speaker. And as I mentioned earlier, I appreciate the analysis and the narrative provided by the Auditor General, her very sound recommendations as they pertain to all elements of our healthcare system, including hospitalization. And there is work to be done, and that is part of the reason why we're investing $250 million new this year in home and community care, so we can pull out some of those patients that are occupying beds in hospitals that don't need to be there, so that those wait times will be reduced even further. That's why we announced nearly $500 million this year specifically for hospital operations this fiscal year to allow us to address some of those capacity and wait time issues, including for important surgical operations like hip and knee in the Southwest Linen in London, for example, Mr. Speaker. But we are making significant progress. And by any objective measure, Mr. Speaker, we have solid evidence that the investments that we've made in our hospitals have borne fruit, Mr. Speaker.
Supplementary.
Thank you, Mr. Speaker. Speaker, the Auditor General's evidence is showing this government is failing Ontarians. But it's not just the surgeries whose wait times are out of control. The Auditor General notes that the government is also failing Ontarians on accessing hospital beds when they need to be admitted. Patients must wait in the emergency room for more than 37 hours to get a bed, often in the hallways or other unsafe areas. 9 years of chronic underfunding and 4 years of frozen hospital budgets are hurting patients. The rationing of health care has patients waiting hours for life-saving surgeries. Operating rooms are going unused, and patients are stuck in hospital beds when they should be elsewhere. Ontarians deserve better from their government than having to wait for basic care. Speaker, Ontarians, the PC caucus have had enough of this government's excuses, waste, and mismanagement of our healthcare system. When will the minister acknowledge his failings and end the rationing of healthcare?
Well, Mr. Speaker, I can't even begin to imagine what it would be like if they had succeeded with their campaign pledge to cut 100,000 jobs in education, in healthcare, Mr. Speaker. But speaking of wait times in Ontario, I know that the member from Kitchener-Conestoga asked yesterday about the emergency department at Grand River Hospital, and I'm happy to update him because he was concerned about wait times in the ER, and I'm happy to update them that, in fact, the Waterloo-Wellington Lynn is #1 in all of Ontario, but the specific hospital, Grand River, has the shortest wait times for high-acuity patients in their ER of anywhere in Ontario. In fact, they're beating the provincial average by more than 3 hours, Mr. Speaker. They have for complex patients, but they're also beating targets for minor, uncomplicated needs. And that Waterloo-Wellington Lynn is #1 in the entire province, has the best results ever recorded in Ontario history for Thank you.